everyone, my name is Victor Lee, and today I will discuss how we can address diabetes through continuous glucose monitoring devices. But first, a little bit more about myself. I'm a rising senior at Bronx Science, and I'm very passionate about computational biology and computer science. I've done a lot of diabetes research, and some extracurriculars that I actively engage in are Model UN and HOSA. I'm a medical nonprofit director, I play the guitar recreationally, and I love to travel. So now let's talk about the main topic at hand, which is diabetes. First and foremost, we must define the term. Diabetes is a term for a chronic metabolic disease where the body cannot produce enough insulin or use it properly. According to the IDF, approximately 537 million people suffer from diabetes worldwide, so we can definitively say that this disease is a global health issue. In fact, this international health epidemic has been on the rise in recent years. As you can see on the graph on the right, diabetes has had a steady increase in 18-year-olds from 2001 to 2020. Amongst the 537 million people with diabetes worldwide, 38 million people are from the United States as seen on the map on the right. And finally, diabetes disproportionately affects older individuals. Now that we've seen how widespread diabetes can be, we can also look at its negative effects. Diabetes imposes a global financial burden costing patients $413 billion in the US in 2022 alone. We can see the impact of this from a poll in the LA Times. Just for one example, 37% of adults decided to hold off on imperative treatments and tests due to high costs. Finally, diabetes also affects one's day-to-day life due to frequent blood sugar testing, a heavily controlled diet, medication management, and demand for physical activity, and sadly, an emotional impact. Just for some more background, diabetes is separated into two subtypes, type 1 and type 2. Type 1 diabetes is an autoimmune condition where the immune system attacks insulin-producing beta cells in the pancreas, resulting in little to no insulin production. It typically develops in childhood or adolescence, and type 2 diabetes, on the other hand, usually develops in adults and is characterized by insulin resistance, where cells do not respond effectively to insulin. It is often associated with lifestyle factors such as obesity and physical inactivity. Treatment for type 1 diabetes requires insulin therapy, while type 2 diabetes may be managed initially with lifestyle changes and oral medications before potentially progressing to insulin therapy. However, both types of diabetes have some similarities like symptoms that include thirst, frequent urination, and blurry vision. Currently, solutions to aid diabetes are not very effective, partially because of the difficulties of balancing the risks of hypoglycemia and hyperglycemia, which will be addressed later. These two terms essentially refer to low blood sugar levels and high blood sugar levels, respectively. Methods of tracking glycemic levels like the finger stick test are not the best because they require frequent finger pricking, are not continuous, are costly, and may be cumbersome to do in public spaces. Similarly, the urine test can be inaccurate due to indirect measurement, also is not continuous, and is not very time efficient. So now let's talk about some of my research, with the most recent title being Long-Term Real-World Glycemic Patterns in Type 1 and Type 2 Diabetes from Wearable Device Data. So, first and foremost, what is a CGM device? I'm going to quickly go over the CGM device and how it's used. So firstly, a tiny sensor is inserted under the skin. The sensor continuously measures glucose levels in the interstitial fluid which surrounds the body's cells. The sensor transmits glucose data to a receiver, smartphone, or insulin pump. Users receive real-time glucose readings, trend data, and alerts of high or low glucose levels. The data is then stored for further analysis or reference. However, CGM devices have not been thoroughly researched yet. Now I will discuss the methodology of my research. So to evaluate the effectiveness of the novel CGM device, we compiled an impressive 1.8 million CGM readings spanning up to 6 years. This has allowed us to create one of the largest cohorts with such detailed long-term glucose data to date. Then, we identified CGM initiators via prescriptions using exact and relaxed name matching for Dexcom data. To enhance data precision, we focused our glucose data analysis on the first 3 years, deliberately excluding the initial 14 days in any subjects with CGM measurements outside of this period. This refined our cohort to include 970 type 1 diabetes patients and 1,825 type 2 diabetes patients, resulting in a robust data set with 637,446 daily glucose measurements for type 1 diabetes and 1,148,072 for type 2 diabetes. Finally, we constructed longitudinal and linear mixed effects models to effectively illustrate the relationships between CGM device usage and glycemic levels. After we did that, we compiled all our models and did some polishing to attain some interesting results. We found that long-term estimated blood glucose levels varied based on frequency of CGM usage. As we can see from the models, those who use CGM devices less had more sporadic and uncontrolled blood glucose levels, and those who used them more saw even a decrease in blood glucose levels. We can also infer that during CGM usage for lower usage groups, other methods were used like traditional finger pricking, and this implies that the CGM device might have an edge over other methods, but more research needs to be done before we can verify this claim. While this study can confirm a long-term benefit of CGM use on glycemic control, a major additional finding was the identification of recurrent seasonal and weekly patterns of glucose fluctuation in both types of diabetes. As you can see on the graphs from the left, we consistently see an increase in blood glucose levels on weekends and in winter months, and enhancing awareness of these patterns of glucose fluctuations for patients, clinicians, diabetes educators. These findings may also help them further refine their approaches to diabetes glucose management and how to utilize CGM better to monitor these efforts. If used correctly, it is possible that we can see a lessening of the global financial burden that diabetes entails through more effective blood glucose management. So, what are some next steps in achieving more manageable diabetes through CGM devices? It's outreach. An earlier version of this research has already been published in the 84th American Diabetes Association Scientific Session, and the new research is currently undergoing the same process in the Science Advances Journal. Also, through nonprofit work, we're working to raise awareness on such topics and more alike. We have many events working to display these kinds of technologies to the youth of our society, and we hope that they'll realize the importance of such technology and contribute themselves to the cause. So, to conclude, I want to highlight the importance of CGM devices in making an impact on the 537 million people who suffer from diabetes today. I also hope to be able to improve CGM tech by garnering the attention of more researchers, and maybe one day we can fix the financial burden and then ineffective testing to make diabetes more manageable for all. Here are some references I used for this presentation. And I would like to thank my entire research team for making all of this research possible and for helping me along the way. And finally, I would like to thank you so much for listening to my presentation, and if you have any questions, please feel free to contact me by email.